Thank you so much. It's really been, it's a great pleasure and honor to be here at the Institute of Medicine. Having been on a committee of the Institute of Medicine before, I know how important these reports are. They really do change the direction of research and practice. So it's a great pleasure for me to think about this question, which is not directly in line with what I do. So it's also been very interesting to learn and hear all the excellent talks today and see how my point of view can help inform what you're trying to do. So I'm going to talk about the impact of the built environment on the neuroendocrine immune axis and health and the implications for design of hospital and non-hospital birthing centers. So just first a disclosure, I have authored a book for the lay public, Healing Spaces, The Science of Place and Well-Being, Harvard University Press, and I will not discuss that any further. So the first question, or the main question that I ask is, can place make you well or sick? I see a lot of people nodding their heads, and the answer is yes. Good. Somebody else started with a multiple choice question, so the answer is yes. So how does it do this? How can the physical environment affect your health? It's really an extension of the science of the mind-body connection, or the science of the brain-immune connection. There are many ways in which the brain regulates the immune system, in which the immune system sends signals to the central nervous system when you are well and when you are ill. So when the hypothalamic pituitary adrenal axis, or the brain's hormonal stress response, is an important way that the central nervous system regulates the immune system through the anti-inflammatory effects of glucocorticoids that are released from the adrenal glands. Also, the sympathetic nervous system regulates the immune system generally at regional levels through innervation of immune organs like the spleen, the lymph nodes, and the thymus. The peripheral nervous system regulates inflammation at sites of peripheral sites of inflammation. And the vagus nerve, the parasympathetic nervous system, also plays a very important role in a two-way street communication between the immune system and the brain, and the brain and the immune system. So what happens when you're stressed? Your perceived stress, and this is something that I think we can begin to think about from all of the talks we've heard. When a woman looks at that last picture of I guess that Dr. Hodnett showed of the beautiful bedroom, you feel relaxed, you feel comfortable, and then you walk in and suddenly there's this awful chair. I mean, people have done studies with people looking at dental chairs and it makes them stressed. So when you perceive something as stressful, two things happen in your brain. The brain's hormonal stress response turns on and you release corticotropin-releasing hormone, or CRH, from the hypothalamus, ACTH from the pituitary gland, and glucocorticoids from the adrenals. And at the same time, you activate the sympathetic nervous system and release norepinephrine and epinephrine from noradrenergic nerves and adrenaline from the adrenal medulla. And together, these constitute what we all recognize as that stress response. Feeling anxious, sweating, feeling your heart beating fast, wanting to run to the bathroom. Anybody who's had a baby knows that your stress response becomes quite activated. And actually, this is a good thing, because it's the stress response that is life-saving, that gives you the focused attention to get the job done and to be vigilant and get out of danger. The problem occurs when that stress response goes on too long or in the wrong circumstances. And when it goes on too long, we call it allostatic stress, allostatic load. So the best way to think about allostatic load is if you wake up in the morning and you have an empty sack on your back, and every single stressful event that you experience, you put into that sack. And then at the end of the day, you're carrying around this heavy, heavy load, sort of like Scrooge and Marley, pardon to the UK representatives here, with their chains dragging behind them, the Dickensian image. And it's that load of stress that can cause illness. And there's a wealth of information now that shows that chronic stress is associated with numerous stress-related diseases and conditions. None of which, if you look at this list, none of these conditions are something you would want in your birthing mother, nor in your offspring. So increased severity and frequency of viral infections, decreased vaccine take rate. If you go get a flu shot, you're still more likely to get the flu because there's a low take rate. Prolonged wound healing, speeding of cancer growth like ovarian cancers, through stimulation of vascular endothelial factor and increase of blood vessels growing into the cancer, and speeding of chromosomal aging. So I'm not going to show you all that data. What I am going to show you is this one piece of data because it does reflect and have great implications for the situation that you are all talking about here, and that is birthing. You don't want to have prolonged wound healing in an individual who's going through a birthing experience. Well, Janke Koch-Glaser and Ron Glaser a number of years ago did studies on chronic caregivers of Alzheimer's patients who were chronically stressed and did skin biopsies and measured how long it would take for the skin biopsies to heal. And in the non-stressed individuals, the controls with the green arrow pointing down there, you can see that by 6 weeks, the wounds were about 50% healed. In the chronic caregivers, they were not healed at all. And I'm just going to show a picture of that just to emphasize this. On the right is the control, the nicely scabbed over, and on the left, still oozing wound. So that's just an example of the kinds of conditions that exist when one is, or that occur when one is chronically stressed. So what do we know about reducing those effects of stress? There's a lot of literature in the field of integrative medicine or the science of mind-body connection, which shows that interventions, and it was interesting that in this panel we heard about practices and settings, and I think those two are very important, because there's no question that the practices that we do within a certain setting can reduce that stress, can reduce the perceived stress, and can reduce the impact of that stress response on the immune system and its ability to heal. So mind-body interventions like meditation, exercise, breathing, just simple deep breathing, yoga, tai chi, prayer, placebo, the belief that something will heal, all of these have been shown to reduce that hormonal stress response, reduce the adrenergic stress response, kick in the vagus nerve, that is, turn on the parasympathetic nervous system, result in release of endorphins and activation of opioid pathways within the brain. This is from brain imaging studies. Release of dopamine and dopamine reward pathways in the brain, also from brain imaging studies. In the interest of time, I'm not showing you all this data. And all this is really good for the immune system and for the heart. So the thesis is, and more data needs to be gathered, but in many ways, physical place and physical environment can play into that equation and can either help foster that stress response or can help reduce that stress response. So what are the elements of place that can trigger the stress response? Noise, crowding, light, too much, too little, odors, bad odors, mazes, novelty, unfamiliarity. How many of you think that sounds like a hospital? Okay, enough said. I'm waiting for the day when the answer in the audience is not a laugh. It should not be that. We should all say, oh, our hospitals are wonderful, calming places. The study that launched the field of evidence-based design was done by Roger Ulrich, and you heard allusion to it earlier, in 1984, published in Science magazine, where he showed that patients who were recovering from gallbladder surgery, who all had the exact same staff, the same doctors, the same nurses, the ones who had a view of a grove of trees compared to those with a view of a brick wall, the ones with a grove of trees stayed in hospital on average a day shorter, needed less pain medication, and had fewer negative nurses' notes than the ones with a view of a brick wall. And this study has been reproduced over and over and over again in different settings. Not so much in the birth setting literature, which is really interesting to me because you've got a lot of data there. And this is where I'm going to be heading, that you have a tremendous amount of data where you could do this exact study. In many studies in different forms of depression with different kinds of sunlight, and numerous studies have reproduced this finding. So why not incorporate elements that improve both mental and physical health in our hospitals, in our birthing units, in wherever we're taking care of patients? So what are the kinds of what are the kinds of physical environment changes that we can introduce to reduce that stress response? Places for contemplation, meditation, prayer, gardens, views of gardens, plants within the room, Areas for social support. Social support is hugely important in health and in well-being and in coping with stress. Areas for exercise. Activities that engage the senses, art, music, and so on. So the Pebbles project was a project started by the Center for Health Design in San Francisco, where they decided that rather than trying to build a whole hospital and with what we think might work and then saying, whoops, it doesn't work and have to throw the hospital down, what they did is they took hospitals that were retrofitting different units, intensive care units, pediatric units, cancer units, regular wards, and looked at the outcome measures of institution of these kinds of physical changes on various health outcomes. And again, I'm not going to go into that in detail because of the interest of time, but this is just an example that I'm showing because of the emphasis that I've heard all day on the issue of transfer and transport. So the Clarion Health Partners Methodist Hospital in Indianapolis created merged critical care step-down units for their critical care patients. And because they found that a big reason for complications and problems in these critical care patients was when they transferred them from the critical care unit to the step-down unit. So they said, well, why not keep the patient there and just change the room around them? And that's what they did. They had these merged critical care and step-down unit rooms, and they found that there were 90% fewer patient transfers, fewer medical errors, greater satisfaction. They also had more areas of social support that contributed to all this. Overall, when the Center for Health Design collated all their findings with the 50 different hospitals that were participating in this study, they found 75% fewer patient falls, 30% fewer medical errors, 11% fewer hospital infections, decreased pain medication use, decreased nursing turnover, and increased staff and patient satisfaction. And it turned out that what was good for the patients was good for the bottom line. They calculated that it would have cost about $12 million extra to build such a fable hospital with all of these physical features, and the cost would be recouped within the first year of operation because of the health outcome savings. So how does this affect the birth environment? We did a literature search, and here I have to really thank Andrea Pizzato, a PhD student in a nurse practitioner, an RN who did tremendous literature search for me, and a lot of it I have to also thank Dr. Hodnett and all the people here who presented, because a lot of the research and the findings that we collated were included in the Cochrane study and the other studies we've heard. So a lot of the research in assessing health effects of birth environments is subjective. It's based on subjective scale, scores, questionnaires. And that's not bad. That's one form of information. And basically there appears to be decreased perceived stress, decreased emotional distress and anxiety, decreased fatigue, increased pain threshold and tolerance, increased patient satisfaction, improved physical and mental wellness, and improved patient safety in patients who are in these alternative birth environments. One example, and you heard reference to it, is the Snozelen room, which is a very interesting concept because many of the types of studies that are done in birth environments focus on changing the visual cues in the environment, putting in art, having a window, having plants around. I was talking earlier to the representative from HRSA who mentioned a young woman who had visual impairment. And you can imagine that if you have somebody who's visually impaired, putting a screen with art isn't going to do much for how they feel. So it's interesting that there are some studies, albeit not random control studies, on the Snozelen room, which includes multisensory effects, not only visual, but also aroma and sound. So it seems in these settings, there is increased distraction from pain, increased relaxation, increased comfort, increased environmental control. There's a feeling of safety and maternal satisfaction and a decrease in pain. So the overall effects of these alternative environments does appear to have beneficial effects on these kinds of subjective interventions and outcome measures. What about physiological outcome effects? There are some studies that show decreased labor time, decreased need for epidurals, decreased length of stay, decreased systolic blood pressure, decreased sensory pain, decreased analgesic use, and decreased pain medication costs. Pain medication is a fairly easy way to gauge in an objective way the effects of the environment on the individual. And then there's one study on fetal heart rate variability. So I'm going to come back to that in a minute. In summary, my gestalt of the literature is that most of the studies are subjective. They are not objective, or if they're objective, they're not mostly relying on physiological outcome measures. So what is needed? My recommendation would be to add more physiological outcome measures at psychological, physiological, and molecular levels. And it is possible to do this now in a non-invasive way without having the person, the woman and the fetus hooked up to all kinds of fancy wires that are pretty scary. And I'm going to show you two case reports that I have been involved in developing these non-invasive methods to measure the effects of the physical environment on health. So the first one was a study in office workers who were in old and new office space, and we used salivary cortisol and heart rate variability as outcome measures, on the one hand of the hypothalamic pituitary adrenal axis neuroendocrine response, and on the other hand of the sympathetic and parasympathetic nervous system. So we were able, and I must say we were a little bit surprised that we were able to detect effects of the new versus old office space on these physiological outcome measures. So it tells you that we have sensitive enough measures to detect the effects of a physical environment, a total physical environment on a stress response. So using heart rate variability, which tells you the balance between the parasympathetic and sympathetic response, the parasympathetic relaxation response and the sympathetic stress response, we found that we could detect higher heart rate variability in the people in the new office space compared to the people in the old office space, and that was the case even at night when they went home. Higher heart rate variability is a healthier rhythm. The parasympathetic response slows the heart and increases the variability between the beats. We also, in the same subjects, showed a lower salivary cortisol response, especially in the morning when they woke up in the subjects in the new office space compared to the old. So on two different aspects of the stress response, we were able to detect the effect of the built environment on the stress response. And interestingly, these subjects did not subjectively report that they felt differently in the two spaces. We also developed a method to measure stress and immune biomarkers in sweat using sweat patches. We're now developing this to a second and then third generation patch. We're working on developing a nanoparticle patch. This is something that's non-invasive that people can use wear on the skin of their abdomen. We're getting to the point of being able to potentially mail it in rather than have to go in to get your blood drawn. And what we found in a proof of principle study in women with a history of major depressive disorder is that we were able to detect patterns of biomarkers in sweat and plasma that reflected the status of the stress and the immune response. So in women with a history of major depressive disorder, they had elevations in pro-inflammatory cytokines, NPY, which reflects the adrenergic nervous system, substance P and CGRP, pain neuropeptides, and a decrease in VIP, vasoactive intestinal polypeptide, which reflects the status of the parasympathetic nervous system. So, and these biomarkers correlated with Hamilton depression and Hamilton anxiety scores. So just to tell you that there are ways to measure the immune system and the stress response non-invasively and unobtrusively, and we're developing a whole toolkit of other methods to get a total view of these two important systems in a non-invasive manner so that we can apply it to conditions such as the ones you're interested in. So by understanding the brain-immune connection, this can help us design healthier, safer birth environments to support both the mother and the fetus and the child in both mental and physical health. I want to thank all my collaborators, both at the University of Arizona and at NIH, and also special thanks to Andrea Pizzato, who did all the great research in this particular area. Thanks to all my funders listed here. Thank you.
Thank you. Very interesting. So my dream always has been that if we're doing salivary cortisol, that we do it on the providers too. So Dr. Christy Waterberg is going to wrap this up for us and discuss the 4 panelists' presentations. She is a professor of pediatrics at the University of New Mexico and has served as the chief of the Division of Neonatology and is now the director of their signature program in child health research. Her primary research interests are adrenal function in the fetus and the newborn infant. She's received funding from NICHD to look at the prophylaxis of early adrenal insufficiency. So she's going to lead our discussion. Please welcome Dr. Waterberg. Thank you.